Good evening, everybody. Once again, welcome to another show. It's Mondays with Maishi. It is just after 9 p.m. on May 5th, 2025. And tonight we have the unusual opportunity of having two presenters, though not two very separate presenters, two quite close presenters. And they are Dr. Mitch Sadar and his dear wife, and Dr. Angelika Sadar. Okay, did I say that right?
Yeah, but I clarify, I'm not a
That's
doctor.
what I
I'm a
wasn't sure about.
psychologist.
Okay,
Yeah.
wasn't sure about that. So, Dr. Mitch and Angelika Sadar, from tonight, we're going to talk about neurofeedback and biofeedback. I didn't realize that we're talking about biofeedback till just about 3 minutes ago. So that'll hopefully enhance and enrich tonight's show. For those of you who could turn on your videos, you know we always love that. Tonight is the process of neurofeedback in therapy. I'd like to learn I'd like to come out of tonight's discussion feeling enriched and knowledgeable about neurofeedback, who it's for, what it's about. We've all kind of seen those exciting wires dripping out of people's heads and wondered, what that all is about and what it means, and can it possibly be helpful to be playing games on a therapeutic level. So we're going to learn a little bit about that tonight because we'd all like to believe that it is, but probably have some skepticism about it. Can you grow from playing a game? I mean, in the olden days, they sharpened their minds with playing chess, right? So it must be possible. But thank you, Mitch, and thank you, Angelika, for joining us tonight. Do me a favor, give our audience a little bit of some background, how you got into neurofeedback, what's your history and background in this field, and how this became a passion of yours?
Sure. I'll go first because I was the first one to be involved in it. I am a clinical psychologist, and I was doing a bunch of things. I was working in maximum security prisons. I had a limited private practice, and I was doing evaluations for Social Security disability. And in that latter job, I was in a room with a bunch of psychologists, and two of them would talk about a neurofeedback. And when I first learned of it, I thought this is really a little crazy. This is a weird thing, but they kept talking about it, and I, in my private practice, had a couple patients that weren't progressing the way that I would have wished, and for them, medication wasn't anything for a variety of reasons. So I was looking for another intervention, and so I went for the training, and that kind of seemed to me to be a thing that made some sense. And so I eventually bought some equipment, and I began to use it on those folks, at first for free. And to my surprise, in a way, they began to get better. And then that gave me the confidence to use it some more. And many of those folks began to get better also. I will say that it isn't the answer for everybody. Nothing is, but I do think that it can be a real good adjunctive tool. And so anyway, Andage was observing the success that I was having, and so a couple years later, she went for the training. And at first, we were a psychotherapy office that did some neurofeedback, but it became apparent, there are many good psychotherapists around, but there weren't, back then, there weren't any any people around doing a neurofeedback. And so we gradually became a neurofeedback, biofeedback office that would occasionally do a little psychotherapy. And that's it. It evolved to a point we were seeing 120 or 130 people a week for neurofeedback, biofeedback. We had techs in our office, and it was good. And then I'll just go a little more, and then I will turn it over to my wife. But recently, as we're reaching the twilight of our careers, we want to get the word out about this. We feel it's a very, very valuable tool. And so we have begun to do a lot more educating. And in recent years, we've done trainings in India and the Okinawa Air Force Base in Japan, and done some teaching in Slovenia. And we were just in Italy, along with throughout the US. And this is a thing that we really believe in. So Ange, take it away.
Well, I want to mention, and this is really where things get exciting tonight, this little twist, that the Sadar's claim to fame, so to say, is their psychological and sports center in Pennsylvania. And this is a place where people have begun to use neurofeedback to enhance their sports performance. We always think of it as enhancing our ADHD performance or other performances. And this was really capitalized by the Sadars for sports people. And I'd love to hear more about that. Angelika, how did that evolve?
That, it's a long time ago, trying to think.
Well, how did you become a sports center? Can't forget that.
Well, so the first thought I have is everybody wants to perform better in life.
Mhm.
And so in that way, anything from a high school athlete to a professional athlete is no different than most other people. Everybody just wants to do better at whatever they're doing.
Mhm.
And I guess Mitch and I both have a background in sports. I did gymnastics in college, had a great coach, and she had everybody on the team learn how to be a gymnastics judge. So I was also officiated my way through college by doing that. And so we just had sports in the background, and we've been drawn to that. And somehow, I don't even remember how, we got involved with tennis, and got involved with junior tennis. Our office does happen to be right next to the United States Middle States Tennis Association offices. And so we were friends with them, and one thing led to another, and we started working with them. And then we were working with professional tennis players. And then we were asked to evaluate professional hockey players, and worked with a lot of college athletes over the years. And so it's just been something that kind of came naturally to us. And again, when you're working with somebody at a very high level of athletics, they all have the skill. They're good players. But the thing that's going to differentiate them and make them more successful than the other player is their mental game.
Mm.
And with neurofeedback, neurofeedback, I'll interrupt my own talking here, started with fighter pilots. So kind of like the ultimate in professional athletes, if you will. And they learned how fighter pilots' brains really were good at turning on and turning off. So there's a high level of intensity when you're engaged in your job. But then when you're just flying from here to there, there's not a high level of intensity. And they're very good at doing that. So that's a skill they need.
Mhm.
Athletes need that too. And it's good for
We
any
all
of
do,
us.
right?
Right.
Right, we all need that.
Right.
Okay, so I'm curious to hear more about that. Let's try to put that in the context of the question of what is neurofeedback? How precisely, obviously, it's a feedback mechanism so that you're getting feedback and that is affecting or influencing your performance and whatever it is. So tell us a little bit about what neurofeedback is, how it works, and then we'll try to apply it to the fighter pilots and the sports people and all other performances.
Sure. So neurofeedback is one form of biofeedback. There's peripheral biofeedback, muscle, GSR, temperature, HRV, so on and so forth. And then there's EEG biofeedback. And so neurofeedback is EEG biofeedback. And put it basically, the brain is electrical chemical. There's no real current way to evaluate the chemical side, even though there's all this talk about the chemical imbalances, but there are ways to evaluate the electrical side. And one of them has been around for a century as of 2024, and the other ones are more recent because of technology. But basically, what you find are frequencies. Everything electrical gets measured in frequency and amplitude. So you find frequencies that are significantly deviant from a database, and then you place a sensor reading that, and the therapist sets thresholds where it wants certain frequencies to get larger in amplitude and certain ones smaller. And that is the feedback of the games.
Mhm.
There's visual feedback, there's auditory feedback, and there can also be tactile feedback. And when the person generates the brain waves that you are calling for with your computer program, the person gets feedback telling the brain, this is good, this is good, this is good. And the brain is a feedback machine, and it's been shown that when you give it the information, it will learn to change itself. And if it changes itself in a way that is better, that just becomes self-reinforcing, and you don't need it to keep it training forever. It just
So through positive, it is what's happening, that the positive feedback is producing some kind of conditioning. It's producing motivation, excitement, and conditioning.
well, it's based upon learning theory, and it's actually, now there's debate whether it's just learning theory or if it's other things, but yeah, the brain learns to change itself, and once it changes its electrical pattern, since the brain is a closed system because of the blood brain barrier, you change the electrical side, you also change the chemical side. And so, and again, the brain's about survival. The brain's evolved, to find a way to do what the person needs. And so if you help the brain find a better way, it it will use it.
I have a short video if if you
Yeah,
want to see a little, at some point I
I was
can pull
actually
that up.
about to play it. I pulled it up.
Ah,
About to play it as soon as Mitch finished his
and if you
paragraph.
want, we can narrate it, right? You can go fast at a faster speed so
Okay,
that
it's only
people
a few
aren't.
minutes. Let's take a look at what this looks like. You let me know if this is the only video, if you have others, and let's just get a sense of what it looks like, and then you'll explain and narrate what it is that was happening.
Welcome. In this video, we will show you the experience a client can expect during neurofeedback training on BMATIC training software. Each session begins with the clinician obtaining a report from the client in regards to the identified training goals being addressed by neurofeedback. When children are the client, involving the parent or guardian is helpful to obtain accurate information. A protocol sheet like this one can be helpful in keeping track of both training goals and protocols. The clinician prepares for training by applying 1020 conduction paste directly to the sensors. Notice all paste is placed in the sensors prior to application to the scalp to avoid contamination of the container of conduction paste. New Prep gel is used to clean the skin of oils, lotions, and dead skin cells. It has a light grit and a light pressure should be applied when rubbing the area. Securing loose sensor wires to client clothing will help keep sensors in place during training. Once sensors are applied, impedance is checked to ensure a good connection has been made. The training is now ready to begin. The clinician will discuss the game options with the client and help guide the choice if needed based on training goals. Here, the client has chosen Dreamscapes, a calmer training options where different environments are featured and explored during your neurofeedback journey. The clinician monitors their training graphs, the client screen, and the client during training. The clarity and color of the training screen, the volume of sounds and music, and the intensity of a vibrating tactile are all experienced by the client to help reinforce the desired response of the brain during neurofeedback training. The clinician will pause training periodically to check in with the client. Changes in training protocol or game may be made to create a more desired effect during training. BMATIC software features a convenient notes area to help keep track of your session and client reporting.
What we look at is what kind of
Hyperpong,
feedback.
a more exciting and lively game focused on eliminating objects from the game boards with a bouncing alien head.
This is what the client sees.
Dual Drive Extreme. Race other cars through different environments. Use brain power to speed the car up and pass your opponents. Toy Train. Your brain is the conductor here. Pick up the identified shapes on the game board using the brain train.
It makes
Tropical Heat. Race around the tropics performing fancy tricks for points. Use brain power to motor your jet ski to first place.
it's the brain that's making the
Training time
game
varies
work.
depending.
What's that?
The brain is what's making the game progress.
Well, you'll explain. Are we done? We're basically done.
Yeah, that's good.
Okay, so give us a little narrative. What is it? What is it that's actually happening?
So what's happening here is the same thing that happens when you're learning anything else. So like right now, people here ostensibly are learning, and what your brain's receiving information, it's actually processing what I'm saying, and it's connecting that with other information. And sometimes we connect better because our brain waves are more engaged. So we can activate those brain waves that focus, for instance. And in this, you saw the therapist screen where there are actually EEG readings of the electrical activity. And when those readings are more in line with what the therapist is looking for. The boat moves, or the ball bounces, or whatever it is. And people like that things are moving, that things are happening. The screen might get clearer. Okay. And that it's getting clearer because the brain is doing more of what the therapist has programmed the system to ask the brain to do.
So I'm just curious, in every computer game from the 1980s and 90s, the Nintendo games and those games that we used to play. Sorry that I'm outdated. I don't know what's out there today. But there was always an element of amping up as you got better, right? So they sped up the Donkey Kong. They put out more obstacles. So isn't that the same kind of neurofeedback? Like why, when I play my little Donkey Kong game, dun 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 dun. Oh no, that's Nintendo. When I play the little game and it gets progressively harder, isn't that the same as neurofeedback?
No, it isn't, because the changes in the games and neurofeedback are related directly to your brain changes. So when I am training a person, I'm watching a screen many hours a day, and there's really little real effect upon me. But if I put the sensors on, the brain right away recognizes that what is changing here is related, and that's a real difference.
So in other words, it's customized to the person's needs and the person's brain, and that's what's going to drive the reward system, I guess, right?
Yes.
The reward is going to come as they improve the particular deficit or function that they're trying to improve.
Right. The brain can recognize when it's doing better. And we all have this experience in different manners. If we walk past a mirror and we see ourselves, we're kind of like, let me fix this. Okay. Yeah, that's right. Okay. I know it's right. Nobody else here would have thought that my shirt needed to be adjusted. Okay. And so if I'm looking at a reflection, a symbolic representation of my brainwaves on the screen, I know when they're doing what's better for me or not. It's just like when you're riding a bicycle, you can't say to somebody, pedal this way, hold your back this way, hold your arms this way,
They have to get
you'll be
they have to
fine.
get the direct feedback.
Right.
Got it.
Exactly. Yeah. Yeah.
Okay. So I'm just wondering if anybody has any questions. Of course, please hit
Please do.
Yeah.
hit the React tab on the bottom of the screen, raise your hand. For those of you who could turn on your videos, please, 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 I implore you, if you can, to turn it on if you don't look too ragged at this time of night. And even if you do, we accept that. So here's what I'm wondering. Take me through the quote unquote psychopathological challenges that people have: anxiety, depression, attention deficit disorder. How does this help with different features and with different challenges or deficits that people have? Like, if you told me ADHD, it helps you, it forces you to focus, and you're creating, generating neuroplasticity, neurogenesis, creating new, stretching your capacity,
Yeah.
right, to concentrate or to focus. I guess I could hear that, right? But if I'm depressed, how does this help?
Well, can we use the example of trauma? We know there's lots of documented information that when somebody experiences trauma, childhood trauma, developmental trauma, even adult life trauma, there are changes that happen in the brain. And we do psychotherapy, and we also over the years have learned that, we need to even do more than psychotherapy, right? So things like internal family systems, or you had on somebody with brain spotting recently. That's a nice intervention with trauma. There's lots of different things that we might do. Might do music therapy, you might do relaxation therapy, but the fact is the brain has changed. Okay, the gray matter is reduced. The neurons are not talking with each other as much. So the brain has like zillions of neurons, and they all need to be talking to each other. And in trauma, certain parts of the communication shuts down and other parts of the communication really activates. It's talking too much. And so if we're seeing that a certain part of the brain is, we use terms like overactivated, we can again program so that when that part of the brain that is overactivated is momentarily not as overactivated, the person gets feedback. And when they get that feedback, it's nice. The game moves and they like that and they want more of that. So the brain starts to try to do that. The brain inherently wants to do good.
So I think you're saying there isn't really much of a difference of what the deficit is. The brain will always be drawn towards positive feedback that it's getting. So if I'm suffering from depression and you put what do they call a skateboard on my brain, so to say, right? Or what did you have, a little jet ski or something, right?
Yeah.
Like you put a jet ski as a representation of my brain, or you put it on my brain. I'm now going to be drawn to getting that jet ski to move, to do tricks, to do shtick, right? And how does that take me out of my depression though? Because
Well,
the only way for me to get the jet ski to move is by feeling better, by generating energy.
well, no, I think the way that we look at this in the field is one of the main things neurofeedback does, and it helps the brain get to be better at self-regulation. So being able to regulate its arousal level. So you may know the old Yerkes Dotson curve where you've got performance over here and the arousal over here, and it's an inverted U-shaped curve. People are prone to either be under aroused or over aroused, and we in this field do not put a lot of credence into DSM diagnoses. We only use them for insurance purposes and for schools. Really, what this is really about is helping the brain to better regulate at its arousal level. So if a person is depressed, it's because the brain is not very good at helping it achieve the optimal arousal. If a person's angry or they've got anxiety, the person isn't very good at lowering their arousal level. And one of the main wheelhouses of neurofeedback and also biofeedback is to help the brain, to help the body become more efficient at the regulation, of arousal.
It might help to say we have all done biofeedback on ourselves. We've all taken our temperature at some point, looked at the thermometer and said, oh my goodness, it's 102. I'm going to go to bed. I'm going to have some chicken soup. I'm going to stay home. I'm going to rest. And then I'm going to see how I do. And then you take your temperature again and you say, oh, what I did worked. That is very slow biofeedback. Okay. With neurofeedback, we get feedback in what's called real time because the sensors are reading what's going on. They're never putting anything in. Okay, it's like the thermometer, it's reading what the brain waves are doing through the sophisticated equipment and then projecting what that is. It's like the thermometer telling you, and in real time, you see it and can make changes. You don't make the changes consciously, just like when you're riding a bike. You know, you're not like, let me activate my motor cortex. Let me recognize that there's a rock 10 feet. You don't do all of that. It just happens. That is really how learning happens. The brain does it.
Fascinating.
You know, if I may, trauma is a big thing lately. And in the psychotherapy field, we say, talk about it and then you'll feel better. In the neurofeedback field, we say, do neurofeedback and you'll be able to talk about it. There are people who are so traumatized that they cannot really talk about it, or it re-traumatizes. Even EMDR, which is very, very good for trauma, the person needs to be able to think about it to get the gradient. But there are people out there who cannot really think about it, or they are re-traumatized. Neurofeedback helps those folks lower their arousal level to regulate their arousal so they can then, benefit from the EMDR and from psychotherapy.
So you're saying it conditions them to be able to stay more grounded as
Yes.
they are, and then they can do things in their, let's call it, performance that they were unable
Yeah.
to, because
Yeah.
the arousal was just too acute.
Yeah. When I have a client, usually intakes are a little bit different. We still do intakes, we do assessments, we engage with the client, we refer and work very integratively with other practitioners who are doing other things. But one of the things that always kind of amuses me when I'm listening with a client early on, I'll say to them, as you were talking, I was listening to you, not only telling me like what your history is, but I was listening to you tell me what your brain does. And I'm just wondering, if you had to make a decision, do you feel like the reason you came here is because like you just haven't figured out life? You haven't been taught right. You don't know how to think through this. You don't know what to do. Or do you feel like the struggle you have is your brain isn't working as well as you'd like it to? And most people say, it's my brain. I know what to do. I just can't get to do. I know I want to be happy. I know I don't want to be anxious. I know I want to, whatever it is, they know what they want to do. They've taken coaching. They've done therapy. Most people that come to us have been to many therapists and they're like, it just hasn't worked. Okay. And they're like, I need my brain. I need my brain to work better.
Guilty as charged right here.
Okay. You know what is a good example? It's like physical therapy for the brain. Okay.
Right.
You break your leg, you can think about your leg healing and you can talk about your leg healing, but you need a cast. And then you do the physical therapy afterwards, and then you start running again. And that's the running is the therapy.
So tell me, how many sessions of neurofeedback do you do a week? How many do you do in total? How does it work?
As a clinician, you mean?
No.
As a client.
Yes. How many?
Because there's two things, there. So as a client, so going back to when Mitch talked about, when we first started, we were of the therapy model. Clients come in once a week. We were an outpatient clinic. And we had a couple of clients that said, this is really working. I want to do it more often. And we were like, nah. And the clients talked us into it and they got better so much faster that then we started offering it. And the typical model is people coming in twice a week, 2 to 3 times a week. And
So
you
2 to 3
need
times a
about
week And when do you start,
minimum.
how do you start seeing, do they start seeing change after a first session, after a few sessions?
Well, it, it depends upon on the person. Some feel it, immediately, but most of the time we are looking to get an effect within about 6 sessions. We're looking, to get something so that it gives the person a reason to keep coming in. And the average number of total is probably somewhere between 30 and 40. It can, some folks, typically the brain needs at least 20 to really learn this. This is a gradual thing, which is a good and a bad. The good is there is no long-term negative effect from neurofeedback as long as the provider changes the protocol if and when the client tells them, hey, this wasn't very good. I felt a little worse here. Well, then you change the protocol.
And a little worse could be something like a mild headache, or I just was
Or a little more anxious, or I couldn't sleep as well. So, but 20 sessions, most people can count on. And then with things like severe autism or seizures or things like that, you can get up to 80 sessions, 90 sessions, 100 sessions.
Okay. And who would you say is your predominant population? Who's coming in? Who's being referred to neurofeedback predominantly, or who finds the greatest relief or success in neurofeedback? Are you working with people who are, what is it called? Slipping my mind. Treatment-resistant depression, or is it ADHD, or is it people coming in without a particular presenting problem, but like you said, for performance enhancement? Who's the predominant population, or is there?
It really could be anybody. I mean, we're pretty well, we have a number of neurofeedback providers in our geographic area, and they refer to us. They're difficult people, like, I've been working with this person and I'm not getting the results I want. Would you see them? But for the general neurofeedback practitioner,
Mhm.
it seems that people kind of develop your clientele, don't you? You kind of like, these are the people that I see. These are the people that I don't know why, they just come to me, whatever that may be. And you got to work within the people that you're comfortable with. Great with kids. Kids' brains are still developing. If you work with kids, awesome. But we've got plenty of adults. We're about 50-50, children and adults.
And it varies. There are times it's 40, 60. I mean, we're a general practice. Anybody that walks in the door from about age 5 to, age 95, and
Right.
whether they're looking to become better at their work or their sport or school or their relationship or with themselves. This is a thing that can help a person just begin to regulate themselves better. And then, yeah.
Yeah. So, questions appreciate the questions, folks. Because I know you have questions. I know people always do. But autism, we've worked with a lot of folks with autism, and my experience with that, I see most of the kids in the clinic, is those parents know their kids, they know what's out there, they've done research. And so it's very rare that we get a kid with autism that is just doing neurofeedback. They're doing something else somewhere along the way. It might be, hyperbaric oxygen treatment. It might be play therapy. They may have, in Pennsylvania, we have wraparound things that are very elaborate. But at any rate, does it work for autism? It is a very good piece of the puzzle in working with autism.
I'm
And
hearing that emotional regulation is a great challenge in autism.
Yes.
yeah,
And frankly, so is rationalization with people with autism. So they're not necessarily interested per se in that you care that they're bothering you. So if they're getting natural feedback, I can see that as being very helpful for them versus getting social or interpersonal feedback, which they care very little about often.
the other thing is they like repetition and they like the routine of like, okay, let's get started. Okay, those kids even help me hook themselves up. Like they know what's going on, and if I miss a step, they tell me I did it wrong. So autism, very good. Schizophrenia, maybe you can talk a little bit more about that. I have not done as much work with schizophrenics.
Well, Nora, I mean, I've had some, but as Ange was saying, there are people in the field who have specialized in schizophrenia. I mean, whatever you are doing, whether it's trauma, whether it's relational things, whether it's depression, anxiety, anger issues, personality disorders, neurofeedback can help you to help the client benefit. I mean, it's just a way to get directly to a person's brain to, help it perform better so that it can then benefit from whatever else you are offering.
As far as ADHD, that's like a whole funny topic. The brain, so typically we have this one big diagnosis, ADHD. And once you move into neurofeedback, we start to look at how is the brain making the ADHD. So there's lots of different ways, lots of different patterns. It's like saying, I have a limp and I'd like to walk without a limp. How do I do that? Well, there's lots of ways your body can make a limp, right? So with ADHD, we want to understand how is the brain making that. The problem can be made because your brain is too, I use the word drifty a lot, okay? That actually means that you have too many slow brain waves that let your mind wander. You can also have ADHD because you have too many fast brain waves that's causing your brain to be over-focused and stuck on something so you can't shift and listen to the next thing you're supposed to listen to. Okay. You could also have anxiety and it looks like ADHD. And if that's the case, then we're going to be looking at how can we use the neurofeedback to alleviate the anxiety, and then you'll be able to pay better attention. When you do neurofeedback, it's very much like the physical therapy. Failing some kind of head injury or some kind of problem that's not anticipated, you're healed, you're improved. Whereas with medication, it's not a long-term solution. You have the medication, right? It washes out. So you have to take it again. With neurofeedback, you reach a certain point and the brain knows how to do it. I bet you anybody here that knows how to ride a bicycle, even if you haven't ridden one in a year, you could probably do it again. And that's the same thing with the neurofeedback. The brain learns it, it holds on to it. With medication, it's not learning it. It's being altered. It's being modified temporarily.
The other thing that I like to say for some counselors, psychotherapists, psychologists, whoever, getting into neurofeedback as their first biofeedback can be a little intimidating. I mean, if it's what you're looking for, then sure. But there are forms of biofeedback, and there's a form called heart rate variability training, HRV biofeedback, which is about the beat to beat variation that should be there with your heart. The heart should not be like a metronome. There can be too little variation, there can be too much variation. When you optimize that variation, and you learn to do that largely by the way that you breathe, what occurs is there is a balancing of the sympathetic and then the parasympathetic, the excitatory side and then the calming side, which they're separate, but they should work together. And this HRV biofeedback is very, very easy to learn. The cost of the biofeedback program is relatively cheap. It's a few $100. And the person can learn this relatively quickly. Then they need to practice, but it can help with attention. It can help with anger issues. It can help with sleep. It's been shown also to help with depression. And so that is a relatively easy way to get into the world of biofeedback and see just the benefits and the way to get it as a part of your practice. And then if you want to then begin to learn about EEG biofeedback, it becomes a little more manageable.
So I would like to say before we run out of time, we're not here tonight because we want more clients. We tried to retire a couple of times and it just doesn't work. But we would love to see more providers learn neurofeedback. And we're very interested in doing that.
Tell us a little bit about what education do you offer? Do you have trainings, workshops, certifications? Tell us, what do you got out there?
Yeah, there is a certification body. It's called Biofeedback Certification International Alliance. And we have an approved course. There are a number of other approved courses. We like ours. And we have really, that course is one part of the certification process if you want to get certified. Okay. And that's a 36-hour didactic course. It gives you some background. We also have the ability to loan people equipment. We don't sell equipment at all. We don't earn money from equipment, but we have a relationship with an equipment vendor, and they send out loaner equipment to people that take our course. And we do Zoom meetings, and we also have practicums at our office in Philadelphia. In the fall, we're going to have a practicum in Las Vegas to kind of hit some West Coast people. So the training itself, the coursework, the basic coursework, the beginning coursework is 36 hours. And then there's mentoring, there's, practicing, there's working on friends and family, there's, then taking it to your clients. This is a pretty tricky thing to kind of unfold for yourself, to go on the internet and look at how do I learn neurofeedback. So we just made a free course. It's not even on the internet yet, but it will be. And if you want, I'll put our website in the chat if that's okay, Musha, to do that. And you can reach us and we'll send it to you. We'll give you the link as soon as it's out. It's going to be out within a week.
Cool.
But that really goes over like in more depth than what we did. It's an hour long. It's 5 videos. So they're like each 10 minutes long. And that'll give you a lot of information on more about neurofeedback, more about biofeedback. How do you learn it? What's involved in learning it? And we even have a whole segment on how does it, we don't talk about this a lot as clinicians, but how do you run a practice with it? And how do you enhance your income with it? There is a time investment of learning it, and there's a financial investment. And we've done some really good calculations. Most people can earn that back within a year. You don't get your time back. But within a year, you can start earning and getting that money back. So that's all in the video, and it's free because you don't got to do
Good,
anything
good.
else. It's
Yeah,
not a
well,
trick.
we could put that out, I could send it out to the participants too.
Good.
I'm curious, tell me a little bit about the research on neurofeedback.
Well, yeah, I mean, 25 years ago, what you heard, there was no research, and that was very true. But if you go to PubMed and you ask it to list the research with neurofeedback, you will see that in the recent 15 years or so, there's been a lot of research. And so it is no longer the case that one can say, if a person says that to me today, I know it's because they've not taken the time to check it out. I mean, we could give you sources where you can go to these websites for bibliographies, and it'll be according to diagnosis. Even though we don't personally care about it, it's a good way to categorize the research. And there's been the most research with attention, but there's research with anxiety and with chronic pain and with migraine headaches and with autism and with on and on and on. I mean, there's this research out there, and if you take the time to look for it.
Okay, fabulous. Does anybody else have any questions on this?
Please, somebody
I
ask
want
us.
to pursue the
Skeptics are welcome too.
Yes.
Good to hear.
I want to pursue the sports part of it. Okay, tell me a little bit about its organization in sports development, sports perfection. Do professional athletes actually use this, and how precisely is it enhancing their performance?
So years ago, the AC Milan, the soccer team, did a whole bunch of neurofeedback training in Canada. And the year that they did that, they won the
World Cup.
The World Cup. Okay. There's been a lot of my background with sports is with tennis. Going back years ago, there's a lot of tennis players, professional tennis players that use it now. The Bryan brothers were one of the first ones that did, and they've won more doubles championships than anybody. Djokovic went on record. He was in Newsweek showing that he used neurofeedback. Billie Jean King, a few people know her. So a lot of you are too young to know her, but she was like a very prominent person in the tennis world. She actually tried to bring it into the USTA training camps. So there's
there's
professional
football players are using it.
yeah.
I mean, it's gaining traction. I mean, again, 25 years ago, 20 years ago, hardly anybody used it, but it's really gaining a lot of traction now. I mean, it's used a lot. You know, golfers, for sure are using it. Yeah.
And
So-
it's used for precision or for endurance or what?
Well, Moshi, again, if you plot out attention, the better you focus, the better you perform. And so even if you think you are focusing pretty good, there's a good chance you can focus a little better. And as Ange said earlier, a lot of these athletes on the physical side are as developed and as practiced. But if you're able to focus better, focus longer,
Mhm.
that's a real advantage. And we talked a lot about emotional regulation. Again, in sports, that's huge. I need to be sufficiently activated, but I can get overly activated because things don't go the way that I want them to, or this guy's doing this and I don't like it, or blah, blah, blah. And that then will have an adverse effect upon the performance, and you need to be able to recover. And so those two very, very basic things can go a long way to help performance.
Excellent. Okay, is there any other last thoughts or questions from the Sadar team, or from the Jewish people on here who just came back from their Sadars last week? Just thought
Very
of that
good.
one now. Just thought of that.
That's a good one. Again, if you're skeptical, we're happy to address that. I feel like it really has changed the lives of so many of my patients that would not have changed otherwise. My first client that I referred to Mitch for neurofeedback was somebody that I had been seeing in therapy for like 8 years. One of those folks that she was bright, she was successful, she was coming in, weekly, and then she came every other week, and then she came once a month, and it was checking in and never just got to the point of where she wanted to be in terms of being able to feel the things she wanted to feel. And she volunteered to see Mitch when he was learning neurofeedback. She quit seeing me, quit coming to therapy after she was done with neurofeedback, referred her husband, who was somebody who would have never, ever gone to a psychotherapist. And he started seeing Mitch. So it's not for everybody, but when it works for folks, they really like it. Contraindications, if anybody can make a mistake. Okay, you need to know what you're doing with this. We are constantly learning. When you're learning about the brain, there's no end to it. So we're constantly consulting with the other providers. So everybody helps everybody to be successful when you're doing neurofeedback. And that's part of what we do. We actually have created a community of our students. We put our students in touch with each other. We're really big on don't do this alone. Become part of a community. It's so important. You all know how important community is.
There was a thing in here about the medication. Let me just say generally, people will come to this wanting to get off of or at least reduce their medication, and it can have those effects. There are times it can help a person get off medication. There are times that the neurofeedback alone is not as good as neurofeedback with medication. I mean, everybody is a little different, but as I said, the brain's electrical chemical, and so the medication obviously is the chemical side. And so, it can help people reduce or get off of their medications.
I know your guys' time is up, and we really appreciate.
Well,
your
let's
time.
we have a question from Elliot
We're
Kaplan.
willing to stay is what I wanted to say, as long as
let's
Moshe's the
grab
boss.
the question. Go ahead, Elliot.
Yeah, so I guess I'm just trying to understand. So, person comes in with anxiety. would the neurofeedback guide him to think a certain thing? Maybe he would think more about his grandmother. I'm just trying to get a sense of how would the neurofeedback reduce the anxiety over time or depression over time? Is there a certain thinking piece to it, or it's
No, it actually helps a person. So I actually saw a client today who has been in psychotherapy a long time. She's anxious and she knows that she wants to focus on positive things when her mind begins to ruminate. She knows what she wants to do, but up till now, it's hard for her. So the neurofeedback, by helping her to regulate her arousal, helps her to be able to use the psychotherapeutic techniques that are available to her. With kids, it can be a little more direct, or with some adults, the person just begins to relax if anxiety is the issue, and they no longer think about their grandmother because they're relaxed. I mean, areas of the brain are involved in controlling physiological arousal, physiological tension. And so if you can help the brain get better at controlling that, the person relaxes and feels better, and the anxiety dissipates.
So a key part of the neurofeedback would be to induce relaxation. Is that like
frankly, that is what the neurofeedback equipment is FDA approved for. It's just approved for relaxation. It is cleared, it's FDA cleared, certain things are, which means that it does the technical things that it says, but the thing that it is seen, that it is accepted to do, is to relax people. That is one of its main things. It can also raise a person's arousal level if you're looking for that, but relaxation is certainly one of the main things.
Okay.
Okay, well, I want to thank the Sadars for coming on and so graciously explaining this to us, an area that's probably underused, but very great to tap into and utilize. For those of you who may be interested in pursuing more knowledge or potentially using neurofeedback, they're quite accessible. So just check out the website or Google them, and let's hope that we can bring more to this area of help and help more people. Thank you very much for joining.